Hi, my name is Haley Tigner, and I am here as your compliance officer to talk to you about the moral right to healthcare that patients have and things that are given to help ensure that they have a right to that. Okay, first off, I'm just going to tell you what we're going to go over today. To begin, I'm going to give you what I think the moral right to healthcare is and um, supporting that moral right. We're going to talk about the code of ethics, medical malpractice, and cultural competency. Okay, so to start us off, the moral right to healthcare. I believe that institutions like this should always be willing and able to provide healthcare to those in need. In order to follow through with this, there are many aspects that will reflect the quality and care we are providing. Within the morality, there are areas that can cause issues, whether they're strictly ethical or if there's something that happens accidental on a physician's end. All these can cause legal issues. Avoiding these issues will provide patients that this is a place where quality care and competence can be provided. And us as professionals should be able to show them that through the way that we're behaving and the way we're conducting ourselves. Okay, so my first supporting factor of the right to healthcare is through the Code of Ethics. According to the National Association for Healthcare Quality, healthcare professionals must practice in a way that focuses on the well-being of the patient through personal accountability of themselves and the way they practice and perform their duties, as well as a moral obligation to do the right thing for those they are serving. As a professional healthcare setting, it is important that we focus on our moral obligation to our patients and establish firm principles and values to be carried out in order to provide them with the best care possible. The first step in doing so is to provide a statement of our values. Through this, our reflection of the principles and commitments we have as an institution should be prominent. For our vision statement, our patients and other consumers should understand our aspirations and the direction of our institution. Our mission statement should explain how we tend to press on with our goals and aspirations. Having a clear vision with these three items will give our patients a sense of moral security in choosing our facility. When we think about how we are conducting ourselves in a professional healthcare setting, we should always be able to ask ourselves, are we doing everything to serve our patients? Are we communicating thoughtfully? Are we present and open to others? Are we being accountable? Are we doing things with good intentions? And finally, are we always open to listening to others and learning new things? My next topic of conversation is on medical malpractice. It is understood that sometimes accidents happen. However, in the medical field, in order to avoid serious legal trouble, accidents should be kept to a minimum, and the attempt to make a mistake should be avoided at all costs. If any sort of medical mistake occurs, the way we handle safety and quality of our care will be questioned and could cost the institution some serious money. Our professionals need to be encouraged to practice medicine defensively, whereas physicians and other healthcare professionals are always aware of what they are doing and practice without the intentions of placing the patient in harm's way. Liability risks are always present when performing a medical procedure and act on a patient. The physician and the hospital are always at risk if an error occurs while in our care. Ensuring that we're an institution that ensures safety and quality of care to our patients, we should always keep this at the forefront of our concerns. According to the Salem Press Encyclopedia, medical malpractice lawsuits have increased in the past decades, and it is important that we are adhering to proper procedures in order to keep our facility from participating in that increase. Finally, I want to talk to you about cultural competency. So patients will come from all walks of life. As professionals, we need to have an understanding of the importance of cultures. Knowing that people are different and having an understanding of the difference is a professional way to conduct ourselves and provide a sense of care. Respecting others' cultures is a meaningful practice and can help maintain great relationships with the patients. Being culturally competent will help the institution avoid consequences of being negligent towards different types of people. Everyone should be given the right to be treated and treated according to their wishes. This is regardless of their cultural stance. Not all patients are the same, and we should take into consideration the beliefs their culture would like to follow through with. If we respect these things and take them in all seriousness, we can be a facility that prides themselves in the quality of care we are providing, and this will also help to avoid malpractice claims and have a sense of goodness. And this all linking back to the Code of Ethics as previously described, we are providing care with complete intention to do good by being culturally competent, as well as encouraging learning and respect for those who view things differently than us, opening up our perspectives. As suggested by a team of professionals in their article, Interventions to Improve Cultural Competency in Healthcare, a Systematic Review, Providing training and workshops for the staff on cultural competency proved to be helpful. Thinking of ways to keep the staff educated and competent could prove to be effective for our facility. Okay, that concludes my presentation. Here are my sources that I use to help me come up with this, and I hope you consider what I've had to say. Thank you.